In 1994, members of the Northern Virginia Dental Society established the Northern Virginia Dental Clinic, a healthcare dental facility in which volunteer dentists, hygienists, and auxiliaries could provide oral health care services for the indigent population of Northern Virginia.
Hello, my name is Dick Spagna. I'm a member of the Northern Virginia Dental Society and a volunteer dentist at the Society's Northern Virginia Dental Clinic. I'm talking today with Mr. Tom Wilson, the Executive Director of the Northern Virginia Dental Clinic. Tom, can you tell us a little bit about the history of the clinic and its mission?
The Northern Virginia Dental Clinic was established by members of the Northern Virginia Dental Society in 1993. It opened its doors to the original clinic located at Bailey's Crossroads in 1994. The mission of the clinic was to serve as a healthcare facility where low-income and uninsured adults from throughout our community could access oral health care services. Here in the Commonwealth of Virginia, oral health care services are not routinely provided through the Medicaid system, and therefore the Dental Society membership started this clinic and to serve the low-income population from throughout our community.
The NVDC actually consists of two dental clinics, one in Loudoun County and one in Fairfax County. Can you tell us something about the two clinics?
The original clinic, as I mentioned, opened in 1994, and it was located at Bailey's Crossroads. It was placed there by local government entities, and it was to be centered in close proximity to service all the residents of all the jurisdictions of Northern Virginia. It had 4 operatories, and it was equipped with equipment that was originally purchased secondhand and then upgraded over the years to the point where we had all ADAC equipment in there, digital x-ray system, etc. Then in 2010, we expanded because of the demand for services to Loudoun County, to serve Loudoun County, Western Prince William County, and Western Fairfax County residents. All the residents that we serve from each jurisdiction are individuals that are 200% of the federal poverty guideline or below, have no kind of insurance, and are adults only, age 18 or older.
Tom, do both clinics serve the same, provide the same spectrum of care to their patients?
We do. We do provide a very consistent spectrum of care. It's quite comprehensive. For many years, we were the only dental program in the Northern Virginia region. Over the last half dozen years, there's been other programs that have upstarted, but each of them provide a much more limited scope of services and have much limited hours of operation.
Are both clinics staffed by volunteers?
Both facilities do rely on our professional volunteer providers, dentists and dental hygienists. We have, over the years, hired some full-time and part-time providers to add to the consistency of our treatment planning and continuity of care of our patients. But we primarily rely on our professional volunteers.
I understand that the Fairfax Clinic recently moved to new quarters. Would you tell us about the new facility?
We did. In December of 2015, we just moved to a new facility known as the Merrifield Center, located at 8221 Willow Oaks Corporate Drive in Fairfax, Virginia, very close to Fairfax Inova Hospital off Gallows Road. This facility is a brand new facility, about a year old, and it has 6 operatories. The county and Inova Health System had built out the space, and it was our responsibility to go out and fundraise in order to equip the new facility.
Well, Tom, can we take a look at this beautiful new facility and learn a little bit more about Northern Virginia Dental Clinic?
Sure, I'd be happy to show you.
The new Fairfax Clinic is an expanded 6-operatory state-of-the-art facility. The clinic is outfitted with all new equipment featuring the most current technology, including ADEC radius chairs, delivery system, and LED operating lights. Sirona intraoral digital X-ray units are located in each operatory. They are used with Schick intraoral sensors. And the Sirona intraoral camera is also available to each operatory. The clinic is also equipped with Dentsply Tulsa endodontic wave handpieces and sonic fill units. A digital panoramic X-ray unit, and a well-equipped laboratory, as well as a spacious and efficient sterilization area.
I'm sure having volunteer dentists and dental hygienists is a great cost saving for the clinic, but still, this has to be an expensive operation. You have the cost of equipment, supplies, maintenance, support staff, all the many costs associated with operating a large dental practice. How is the clinic supported?
Well, the clinic is supported primarily on two avenues. The first one being is fees that we collect from patients for their care, which is we charge patients $40. It's a flat rate of $40 per visit, and the providers are instructed to provide as much care as they can reasonably deliver within the 45-minute to 1-hour appointment time. That equates to approximately 43% of our operational costs. The other 57% of revenue to help us operate throughout the year comes from grants from private foundations, local governments, and private and corporate donors.
What happens, Tom, if you have a patient who just can't afford the $40 fee?
The clinic maintains a patient assistance fund so that if there is a patient that cannot afford the $40 payment, that we can assist with funds from that account. Likewise, many of our patients are connected to local churches or religious orders or civic groups that will sponsor them and pay the $40 for them on their behalf.
Tom, I know how important volunteers are to the clinic, so let's talk a bit about the need for volunteers and how a dentist or dental hygienist can help.
Volunteers, Dick, is probably one of our most critical needs at the clinic. It really is the most vital part of our operations. Dentists and area dental hygienists can simply volunteer. It's quite easy, actually. They just pick a date that they have some time during their day that they can contribute to us. Normally, I ask that they come in increments of either the morning or the afternoon, and also we have some evening hours here at the Fairfax Clinic. So morning patient care starts at 9 a.m., ends at 12:30. In the afternoon, it's 1:30 to 5 o'clock. And so it's basically about a 3.5-hour stint of time.
How frequently do you find most professionals volunteer?
Most of our volunteers volunteer at least once a month for a half a day, but we only have about 10% of the Dental Society membership that's currently volunteering. If we were to even get half of the Dental Society membership to give us a half a day a month, we probably would not have enough chair hours in order to have them come more than once a year. So if we broaden the scope of the percentage of volunteers, we probably could do a whole lot more. And there's a great deal of need in our community.
If someone couldn't quite make the once a month commitment, but perhaps could come every other month, would they still be appreciated?
Absolutely. Any time that anyone can contribute is obviously deeply appreciated. Whether it's once a month, whether it's once every other month, whether it's quarterly, even if it's semi-annually, any time that anyone can spare is a great help to our cause.
Tom, I want to thank you for taking the time to speak with us today about the Northern Virginia Dental Clinic. And if I may add a personal note here, speaking as a volunteer in this clinic and as a dentist with almost 48 years of clinical experience, I can honestly say that I have never felt more proud of my profession or its practitioners than I do when I take part in the good works that are done here.
Thank you, Dick, for your time and your volunteerism and your support of our facility.